I am going to talk about one of the most common presenting symptoms that we see in physical therapy, headache and dizziness, which we call vertigo. When someone has a headache and dizziness or vertigo, there are two ways to categorize these symptoms. There's an acute presentation where it just started maybe from a head injury. Maybe it's been building for a week and now it's really bad. Or somebody who's had this condition for a long time. It may be chronic. You don't know how long you've had it. It's just always been there. Maybe you went to see another professional and they gave you some medication for your headache and the headache went away, but the dizziness never did. Or maybe they didn't even give you a diagnosis, or they gave you a diagnosis, but you're still having symptoms. So either way, today I want to talk about the different causes of headaches and dizziness. We're going to talk about what might be causing your headache or your vertigo. And then we're going to talk about how physical therapy can help with these symptoms. If you're not getting relief from other treatments. Now, before we get into the causes of headaches and dizziness, let me explain why it's a good idea to seek out physical therapy for this condition. The thing is, most people with headaches and dizziness have no idea that physical therapy can actually help them. They just go straight to medications. Medications work for some people, but not everyone. And when they don't work, people are often surprised to hear that physical therapy can help. But the reason for that is because headache and dizziness are often caused by problems in the neck and cervical spine. And that's something that physical therapists are trained to find and fix. So if you're not getting relief with medications, you should definitely consider seeing a physical therapist to find out if you're a headache. And dizziness could be helped by physical therapy. The first, because I'm going to talk about, is called cervicogenic dizziness. This is a fancy way of saying that your cervical spine is causing your dizziness, and this happens more often than you think. It turns out that the cervical spine, which is the neck portion of the spine, has a big influence on our balance and spatial orientation. That's why it is really important that we do a thorough examination of the cervical spine when someone presents with dizziness. Now, what does a cervical spine problem look like? Well, there are many ways it can present, but typically I find that there will be some limitation in neck range of motion. There may be some pain or discomfort in the neck, and there may be some tenderness along the occipital ridge. That's the ridge along the back of your skull where all those muscles come together. If you can reproduce your headache and dizziness by moving your neck into certain positions, then that's a really strong sign that the problem is coming from your neck. For example, sometimes people will notice that their symptoms get worse when they turn their head to one side, or maybe they feel better when they support their head with a pillow, or when they look down at their phone. These are all positional maneuvers that can help us figure out if the problem is coming from the neck. Another cause of headache and dizziness is called benign paroxysmal positional vertigo, or BPV. This is a condition that causes brief but intense episodes of vertigo or dizziness that happen when you move your head into a certain position. Typically, these episodes only last a few seconds, but they can be very intense. People often describe it as feeling like the room is spinning, or they may feel like they're re-spinning in the room. Usually this happens with a change in head position, like lying down or sitting up. Sometimes it happens when you turn your head or bend your head forward. For example, when someone has BPPV, they might feel dizzy when they quickly turn their head to look over their shoulder to see who's honking at them when they're re-driving. So what is happening here is that there is some little calcium crystals called otoliths that have broken off inside the inner ear, and they're refloating around in there. They normally help us sense gravity and position in space. But when they break off, They kind of float around and jam up the system. And then we get all kinds of crazy signals sent to the brain, and that S what causes the dizziness. Now, this is something that physical therapists are trained to identify and treat, and we use a series of head movements called the Epley maneuver to help reposition these crystals so they settle down and things return back to normal. Now, I am not going to go through the Epley maneuver in detail in this video, but if you have this condition and you want to learn how to do the exercises at home, you can check out my channel after this video and search for BPPV. Another cause of headache and dizziness is called a cervical artery dissection. This is a less common but more serious problem that occurs when the artery in the neck gets torn or dislocated, and that causes bleeding inside the cervical spine. The symptoms of a cervical artery dissection can include a sudden onset of severe headache and dizziness. Neck pain is usually present, as well as pain in the back of the head and the shoulder. There may also be some numbness or weakness in the arms or hands. Now, if you're re-experiencing these symptoms, you need to go to the emergency room right away because it's a surgical emergency. All right, the next condition I'm going to talk about is called Meniere's disease. This is a disorder of the inner ear that causes vertigo, tinnitus, which is ringing in the ears and hearing loss. Unfortunately, there is not a lot of great treatment options for Meniere's disease, and physical therapy is probably not going to be helpful for this condition. All right, the next one is vestibular neuritis and labyrinthitis. These are basically the same thing, except for one has a more specific type of symptom. In vestibular neuritis, there is inflammation of the vestibular nerve, which is a nerve that sends signals to the brain about head position and movement. With labyrinthitis, there's inflammation of the inner ear and the vestibular nerve. Now, this can happen as a complication from an upper respiratory infection, or it could be caused by a virus. Either way, the symptoms are similar, and they include vertigo, nausea, vomiting, and loss of balance. Now, vestibular neuritis is usually self-limiting, which means that it will get better by itself within a few days. But this can be a long time for someone who is experiencing these symptoms and they pretty miserable. Physical therapy may be helpful for some people with vestibular neuritis, and we can use a variety of techniques to try to reduce the severity and duration of the symptoms. One thing we know is that vestibular rehabilitation is better than doing nothing. That was shown in a study published in 2013. Another thing we know is that vestibular rehabilitation is just as effective as medications for treating vestibular neuritis. So instead of relying on medications to get better, someone can choose to participate in physical therapy and perform exercises to help the nervous system compensate for the symptoms. All right, the next thing I want to talk about is the difference between somatic and psychogenic dizziness. Somatic dizziness comes from a body cause, and we've talked about several of those already. Psychogenic dizziness is a bit more complicated because it comes from a psychological cause. Now, that doesn't mean that the dizziness isn't real. It's just that it comes from a psychological cause rather than a medical cause. The problem with psychogenic dizziness is that it can be hard to treat because it often requires psychotherapy and sometimes medication to manage the underlying condition. It can be challenging to distinguish psychogenic dizziness from somatic dizziness, which is why it's so important to get an accurate diagnosis. Finally, I want to talk about medication overuse headache. This is a condition where someone has taken too much pain medication over a long period of time and it has caused a secondary headache. When someone has a medication overuse headache, they usually have a daily pattern of taking medications for the headache. And then they notice that they keep having headaches on a daily basis, and it seems like they really not getting any better. One thing that can make this problem worse is that taking pain medications triggers the release of a neurotransmitter in the brain called glutamate. Glutamate is involved in the transmission of pain signals in the brain. So the more glutamate that's released, the worse the pain becomes. This leads to a cycle where the person keeps taking more and more medication to try to get rid of the pain, but in reality, they're just making the problem worse. Now that we've talked about some of the common causes of headaches and dizziness, if you're still not sure, what's causing your headaches or your dizziness? Then check out my next video on how to examine your own cervical spine to determine if it is causing your headache and dizziness. Also, if you're new here and you like this video, make sure to subscribe because I put out new videos every Monday and Friday. Thanks for watching and see you in the next video.